New at 4, major changes to guidelines on treating childhood obesity. This week, the American Academy of Pediatrics emphasized a need for early and intensive treatment for kids. We sat down with local doctors to help you and your family navigate these changes. Childhood obesity is on the rise. According to the CDC, 20% of all kids in the United States are obese. We're talking nearly 15 million kids and teens in the U.S. struggling with their weight. New guidelines from the American Academy of Pediatrics now pushing a more aggressive approach to combat the crisis. While lifestyle changes like eating fresh food and getting more exercise remain the recommended first line of defense, if that doesn't work, the guidelines urge doctors to seek alternative, more intense solutions to help kids who are most at risk.
We have several options for medications, medications for children who may suffer from hunger control that they can take by mouth. And we also have medications that may be injected into the skin.
If treating kids with medication to manage their weight seems rather drastic, that's by design. These new guidelines promote active problem solving with proper oversight.
I don't think anyone's in a rush to say like, oh, obesity, here, just take this medicine and it makes it all better. That's not really how those obesity medicines work. You still have to have the foundational discussions and change and work of, let's talk about exercise. Let's talk about what we're putting in our body and nutrition. Some of them do come with potential trade-offs and risks. There's, at least a half a dozen medicines worth considering, and they all have their own nuanced pros and cons.
Experts say the fact is, if obesity isn't addressed in childhood, it can have lifelong health implications.
We may see weight affect the liver and something called non-alcoholic fatty liver. If you're a pediatric cardiologist or subspecialist, you may see that weight affects blood pressure. We can also see weight affect the joints, and orthopedic surgeons may need to even operate on the hips when they carry extra weight with children.
It's why the new guidelines recommend multi-approached intensive treatment for one of the most common chronic conditions in kids before it's too late.